Almost a year ago, we launched the Scoop on Ultrasound podcast, and the response has been even more positive than we originally anticipated. From the practical applications of AI in ultrasound to how to overcome challenges as sonographers, our guests touched on a range of thoughtful topics. To conclude season 1, we decided to make a recap of some of our favorite moments from the season. To be honest, it was quite hard since there were so many great moments from the show. Before we get into the episode, I have some exciting news to share with all of you. The Scoop on Ultrasound is now available on your favorite podcasting app, whether that's Spotify, Audible, or Apple Podcasts. You can find the show there, subscribe, and be notified when new episodes are released. We hope you enjoy the recap and that you stay tuned for the soon-to-be released second season of the Scoop on Ultrasound. Quality supplies make a difference. At EDM, our mission is to help you enhance patient care. For over 30 years, we've been a leading supplier of medical imaging products and accessories. It all started with one product, Crystal Ultrasound Gel, and now our catalog includes over 300 products designed to support your practice. From probe covers to needle guides, EDM Medical Solutions is the partner of choice for over 2,000 healthcare facilities in the US. Learn about our range of ultrasound solutions on our website today by visiting us.edm-imaging.com. The landscape is changing a lot. You have a lot of sonographers on your team. So given how quickly, technology advances and these studies that are being done on the AI, how do you ensure that your team is up to date on the techniques, on the technologies, especially when you have sonographers who've maybe been doing it for a while and they're used to the way they've been doing it? Then you have new ones. I mean, do you automatically bring them into this AI culture? Or how is it that you've been doing that with the different people you have?
Right now, our main site is really struggling in that, and like most echo labs, we've been so short-staffed, and so as soon as the new grads graduate, we're getting them in, and so most of my satellite sites have my more senior sonographers, but my main lab has a lot of sonographers with less than 5 years of experience, the majority of them. Yeah. And so that's been a really struggle to make sure that, quality and education, is kept up with these people. And there's so many, I have over 50 sonographers.
Right.
So that's been a real struggle. We are lucky that we do have the educator. So we do have, extra resources for our lab, which I understand that, not all labs can have that, but yeah. So we have an educator and she does all the QA, QI, accreditation, teaching of new technologies. She will also arrange, we're going to start using the dynamic heart model on Philips, which is also an AI feature. So we're going to start doing 3D left ventricular ejection fractions with dynamic heart model on all our patients as part of our standard protocol. And so right now we're just doing a lot of education, and we're also reaching out to the vendor for support in the education. So the vendor comes to all of my sites, does, hands-on training with all the sonographers. And then once we start this process, and the educator will make sure that, we'll do QA and QI measures for whatever we start that's new. The other thing we've done is we've created mentor roles within our lab, and then they're informal roles, so they're not a formal title, but the sonographer who is a mentor gets a day off of the clinical schedule to help with training new employees, helping the educator with QA and QI projects. And so this helps in such a big lab that we have.
And then lastly, you mentioned in the article the pandemic. Which, of course, that was a very difficult situation, especially for any practitioner working in a hospital. It was really hard. And we're all familiar with how burnout, unfortunately, did become far too commonplace in healthcare during the pandemic. And in some cases, many practitioners might still feel burnt out. Some have even left healthcare as a whole, unfortunately. So from your position in leadership, what advice would you give to sonographers so that they can avoid burnout, especially new ones who feel like, man, I just started and I'm already tired? And what are some ways that sonography leaders themselves can really minimize that risk of burnout on their team, especially again in a hospital context or in a high volume facility where stress is sadly too common? What would you say, you know?
I would start out by saying never lose focus or sight of your why you began in the first place. Did you
Yeah,
have a passion that you're trying to live out? Are you heading somewhere? What does your life look like in 5 years? Who is that person? What does that person do? You then start to see things instead of the now, you see further down the road.
yeah,
So you are more likely to make whatever adjustments you need in order to get there. You're reminded, okay, especially during the pandemic, we were scared just like everybody else. We didn't understand
yeah,
what was happening, but I knew that I needed to be here for the patients. I needed to be here for my team. I was going up to the COVID rooms just like my whole team. We were all writing it out together.
yeah, yeah,
So keeping your why in focus, and it's so easy when there's so much noise to kind of find the music, but if
yeah,
you could really focus on why you're doing this in the first place. Now if you don't have a why, I can understand it would be easy for you to get discouraged when
yeah,
things aren't good, because things are good when they're good, but when they're not good, then what do you have to
right.
fall back on? Then the other thing that I would say is self-care, and this is something I had to learn recently. I'm the type of person that will stay in the office. I'll be the first one here and the last one to leave.
Yeah,
But you have to remember that while you may feel like a superhero, which we are, you're a human being. You get
right,
tired. You need sleep. You need exercise. You need fresh air. You need
yeah,
a vacation. You need a massage. You need to talk to somebody.
mm,
I remember having a very difficult case where this was a patient who postpartum went brain dead because of complications, and the family had to
wow,
make a decision to withdraw care. And that was terrible. I wept with the family while I was doing
wow,
the echo.
yeah,
So you have to talk to somebody about that
yeah,
to
wow,
figure a way how to channel that energy somewhere else and to
mm,
to recenter yourself. So self-care is very important, and just keep your why right here. Always remember why you're here,
yeah,
why you're here, and then things will be much simpler. It won't be solved completely, but
yeah,
it'll be easier to make the right choice.
Yeah, my pleasure. I believe patient-centered care is of utmost importance in any healthcare institution. As you mentioned, there's competition here in North Carolina, where I live now. We have UNC Health, where I work. We have
mm,
Duke University, Duke Health. We have Wake Med, and there's just tons of competition here in the
right,
area that I work at. So one example that I can think of is the care that we provide for our cardio oncology patients. These are patients that are coming in to have an echocardiogram before their chemo treatment, during their
mm,
chemo treatment, and post chemo treatment. And the idea is to get a baseline of the heart, to understand what does the heart look like, how does it function before chemotherapy has begun, and then monitor that heart function and see if maybe the chemotherapy has damaged the heart. So
mm,
with these patients, what I have noticed as a manager is that when my staff delivers that excellent patient-centered care that we're talking about, these patients will call before they schedule their appointment. This has happened many times to me. They'll call before their appointment and they'll say, "Hey, Sus, can I please, before I schedule my appointment, can I please make sure that this specific sonographer is there?
mm,
Because I would like
wow,
for them to
wow,
take care of me again." And I see this all the time. These patients come in at first for their pre-chemo echo. They get one sonographer. They're treated awesomely, the best.
wow,
They get that amazing patient care that we're speaking of, and they love it so much that they want that same person taking care of them because they realize that this is just great care that they're not going to
yeah.
find anywhere. So that's one example that I can think of. Patients returning back to us and wanting to be cared by specific sonographers that are delivering that excellent patient care.
Definitely. So the first thing is definitely self-advocacy. I'm a strong proponent of sonographers being self-aware of their surrounding, their patient load, of what their physical limitations are, what they can do and they can control themselves. Definitely play a part of their career longevity. So, like, let's say, they know on average if they do more than 7 or 8 patients, in a very consistent cadence, and they start getting ache in their back, right? Maybe slow down a little bit, talk to their lead techs, talk to their supervisor, let them know that they're experiencing pain after a certain amount of patients, see if they can, get like at least just 5-10 minutes between patients to just
Right.
stretch, right? Also, like just getting a stretch, like a stretch band, or some kind of like a ball for them to squeeze in between their testing, and just knowing what to do to really activate those tendons, and just like relaxing those muscles in between those testing really does help. The second thing they could do is definitely like positioning, right? So positioning definitely plays a big role in injury, in my opinion. I think when they're scanning patients, especially, just take those 1 or 2 seconds. Let the patient know, hey, you're maybe a little bit too far from me. If the patient can move, just say, hey, can you scoot a little bit closer to me, right? And the
Right.
patients always do that. They listen to you, right? So don't be too afraid to voice yourself. Be your strongest advocate, right? Because if you don't advocate for yourself, nobody's going to advocate for you.
Yeah.
And then the last thing that they could do is definitely, go to, there's a website that I really encourage all sonographers to go. It's called healthysonographers.com. I usually
Mm.
just use that as a resource, and I just let my techs know that, hey, you can just go there. It just have a lot of great resource and white paper for them to reference of what they can do and what kind of things they can do to alleviate some of their pain. But yeah, I would say, like, even outside of work, just enrolling in a gym, just going to the gym and just strengthening those muscle, definitely does help. And even having like a regular chiropractor or massage therapist, all those things, little things, does add up, and it really does prolong your career in this field.
Just healthcare in general, we're seeing an immense shortage. Specifically for cardiac sonographers, though, I think the most recent numbers that I saw was that about 70% of labs nationwide are working understaffed. And our lab is part of that. And additionally, schools, at least in our area, are seeing a decrease in numbers as well. And they're attributing that to the COVID-19 pandemic as well. But fortunately, our credentialing bodies, Cardiovascular Credentialing International and American Registry for Diagnostic Medical Sonography, they have pathways to do on-the-job training. So CCI, they have 2 pathways for those individuals. Someone who is a graduate of a diploma, an associate's, or a bachelor's health science. And that's going to include like cardiovascular technology, ultrasound, rad tech, respiratory therapy. And then they'll come to a program like ours where they then do 1 year of on-the-job training, and then they're able to sit for board exams. The other one is somebody who is already an active credential holder. So say maybe general ultrasound, they can come and do an accelerated pathway, which is only then 6 months of training with us, and then they're able to sit for the board exams. And I believe ARDMS is very similar in that they have 2 pathways for that as well. So you can have a single 2-year allied health degree, like physical therapy assistant, rad tech, RN, and then you have that 1 year of on-the-job training. And then the other pathway would be anybody that has a bachelor's degree and then has that 1 year of on-the-job training. So you could, in essence, have a finance bachelor's degree, and you could come and be a part of a program.
Oh, wow.
And sit for exams after 1 year of on-the-job training. And so, I think to answer your question, really, since we're seeing shortages in both schools and general applicants as well, we have found that we have a recruitment effort within our own organization. So we're finding qualified candidates in our own organization, those that have ties to the community, those that want to stay and work for our organization, because at the end of the day, this is a 1-year commitment. And so that takes a lot of time. It takes a lot of resources. And the last thing that you want to do is have someone train for an entire year, take their board exams, and then leave and go somewhere else.
Exactly. Yeah.
So what an opportunity that we have to provide a wonderful experience, to provide that training, so that when people become fully trained, they don't want to go anywhere else.
If you are high-level disinfecting your ultrasound transducer, it's likely you're soaking the probe or using an automated HLD device. But there's a better option out there. TriStel Olds can high-level disinfect your transducer in just 2 minutes and costs under $3 per cycle. Sound too good to be true? Request a brochure today and learn why so many practices are switching over to TriStel Olds. Visit us.edm-imaging.com/TriStel. That's TRISTEL. And now, back to the show.
So I think, as with all things in healthcare, sonography is not alone, that it's constantly changing and evolving. It is important that sonography programs maintain the standards of the field and to provide education to students on new advances in technologies and best practices. I know you mentioned AI. I think that would be my go-to when I see trends and advancements in sonography. I think AI can very much help aid the sonographer in their day-to-day practice. But I do think it is important to recognize and appreciate the knowledge and expertise of the sonographers, that AI is used to help, it's to aid the sonographers and not necessarily replace them, which I think is a conversation that comes up in sonography a lot. In education, I am an educator. I do hear about AI and ChatGPT and the fun things that come along with it. I think, like you said, it's here to stay. We're very much on the tip of the iceberg when it comes to it. And I think sonography programs themselves and sonography as a field, we're learning to adapt with it and to try to take, to see it from a benefit, and to really kind of use AI and that kind of thing to help the sonographer, and to try to make their lives a little bit easier when it comes to scanning.
Right now, do you see it as a challenge for new students that there's such a rapid introduction of AI? Do you think, or have you perceived a collective fear of like, oh, are we going to be replaced? Which, I know you don't believe that that's the case, and I don't either, but still, to someone new who's coming in, maybe they think that.
Sure.
Or do you think that there's also the risk too that we have new sonographers maybe who are no longer perhaps putting in the same effort maybe because of a reliance on AI? Are those things that you've perceived, and how have you addressed that, if so?
I think yeah, sure. I think it's important as a sonography educator to really teach a well-rounded education when it comes to it. I don't think that there is a negative with embracing things that make sonographers' lives easier when it comes to scanning. But I'm also someone that thinks it's very important that the sonographer knows what they're doing and why they're doing it. So if AI is going to make their lives easier, they still have to have the knowledge behind what AI is doing. That way, we all know that technology is great, but it doesn't always work the way we want it to. So it is very important that sonographers, and especially sonography students, they know where sonography came from, how much it's adapted, how much it's evolved, but they still can take advantage of the advancements that is coming in the field.
Big need. And so from your point of view as an ultrasound educator, what do you think are some of the main obstacles that stand in the way of more sonographers saying, hey, I want to be an MFM sonographer, I want to specialize in this? Why do we have such a shortage, even though I know that we have a shortage in general of sonographers, right? But in this area specifically, what are some obstacles that you observed?
So one of the main obstacles that I've recognized is specialized training opportunities, right? So MFM sonographers, again, like I mentioned, they require such a unique skill and education specific to high-risk obstetrics. That in itself is also lacking in your, typical diagnostic medical sonographer programs. So most MFM practices, I would have to say, require some experience, but a lot of sonographers ask, well, how do we get there, right? How do we get to that level? So you always have that gap. So I feel that organizations and institutions, they really have to invest that time for training and education to sonographers with even the little or no experience to become proficient in MFM. So I feel like that's one of the biggest barriers, is just providing that opportunity for training, specialized training.
So would you say that on-the-job training is important? Like, is that a potential pathway for us to get more MFM sonographers?
Yes. On-the-job training is currently the only existing pathway for sonographers to train into MFM. At this moment, there is no formal certification or educational pathway for that route. At Scripps, we developed what we called the Perinatology Transition Sonographer Program. Back in 2021, we have completed about 3 cohorts. And in order to address that gap, we are training sonographers who have little to no experience in maternal fetal medicine. The training program takes about 6 to 12 months. And this is what we've learned in order to train an MFM sonographer or sonographer with no MFM experience into MFM proficiently.
Well, I hit on it a little bit when we first started talking. When I was able to get into a lab years ago, that you were waiting for that person to retire, that person to move away. Now, pediatric hospitals all over the country have openings, have a lot of openings. There's a lot of travelers, which we didn't see pre-pandemic. I think that, it's important to get the word to high school students. I'm really fortunate at Lurie Children's. We have a team that's called the Workforce Development Team, and it's a whole group of people that they target schools, and they go to teach kids about all different healthcare careers. And so I'm one of their consistent volunteers, and I talk to kids, not only high school students, even junior high students, to pique their interest in going into healthcare, but then the high school students telling them about this career, because when it depends on your counselor is not going to know every intricate detail in every field. And I think even now, it's still, when you go into a hospital, you're a nurse or a doctor, and that's it. There's no in between. But once you get into healthcare, there's so many in betweens. And so I think focusing on the next generation coming into the workforce, that's very, very important. And then education. The American Society of Echo just released their new pediatric echo guidelines. But I think on a society level, there needs to be more with engaging with colleges, college-age children, high school-age children, but on a society level. Because I'm in Chicago. I'm in one very small part of the country where, on a society level, we could do a national meeting and talk about this profession and get people excited and get people connected. If Billy in Tennessee somewhere wants to do an is interested in echocardiography, maybe we could pair him with somebody in Tennessee that could mentor him with the right programs to go to, etc. And so I think that there definitely needs to be more on a society level to keep our profession growing. If not, the shortage is going to be here. It's like no end in sight. Patients are getting sicker and sicker. And with us not having people going into the field, what do you do? And then the hospitals are also competing not only with a lack of students, but then even within the hospital, there's always people that will want to go into industry. And so they're on the other side. They're still in patient care. They're just on the other side of things. They're not the front facing anymore. And so there's that competition too. So we definitely need more and more people.
Now, what are the potential risks, though, associated with not using them? So could you tell us a little bit about that? Because sometimes I think there's a bit of a skepticism about how important they are. Like, can I just, like I said, disinfect? If I'm disinfecting already, isn't that enough? Could you tell us a little more about those risks that are there if you kind of just forego using the barrier when you should?
Yeah, there are many potential risks associated with not using an ultrasound probe cover during an ultrasound guided procedure. Just due to the electronics in the ultrasound probes, they're never able to be fully sterilized between procedures at all. And high level disinfectant is what's commonly used for higher risk exams. And I mean, it's good, but it's not 100%. And traveling from patient to patient to patient without sterilization, because you can't, and without using a probe cover can cause a higher risk of transmitting bacteria and viruses, which can lead to healthcare associated infections, also known as HAIs, such as MRSA. I mean, the big ones are MRSA, C. diff, hepatitis B and C, HIV, AIDS, HPV during vaginal exams. And the real heroes are the healthcare providers. They are the ones always advocating for protection of their patients. And just due to the advancements in diagnosis and treatment with ultrasound, there are really easy ways to protect both the patient and the probe from coming into contact with those viruses and bacteria that unfortunately do exist in the clinical environment.